All right, thank you, Madam Chair. And Dr. Walensky, thank you so much for taking time earlier in the week to chat. I'm going to talk with you a little bit as an extension to what you just shared with Congresswoman Frankel about new ways and innovative ways to reach out to people, specific in this case to rural America. I talked with Dr. Fauci about this yesterday at our hearing. He was going to take the questions that I was asking about reaching rural residents and try to come up with some new ideas, but want to talk specifically about the disparity between those who live in rural counties compared with those who live in more urban counties. We know by the numbers that CDC has released that it's less than 40% of residents in rural counties who have received at least one dose, compared with just about 46% in urban counties. And so it is, I want to hear your thoughts about vaccine hesitancy, other issues that are specific to rural counties. If I may throw out an example, in the congressional district that I serve here in Northwestern Illinois, we have one county, which is a couple counties south of where I'm talking with you right now. It's along the Mississippi River. The entire county has 6,700 residents. And early in the, for people to sign up for the vaccine, they just had a couple phone lines. Broadband is spotty at best. Their volunteer corps, as far as getting people out to help, were very, very senior themselves and were concerned about getting COVID themselves. So that was all brought to a halt. They were registering people. There was no online portal to register. It was all handwriting, paper and pencil. And so now, with the announcement that just came out earlier today, where we have half of the adult population that is vaccinated in this county, only 19% overall is vaccinated. And so just these great big disparities. So I'm just wondering, Dr. Walensky, on top of what you just talked about, and I'm very curious, like, can I get a Chicago Bears player to come to Henderson County? I mean, I'm just wondering how that might work. But what steps is the CDC taking to increase these vaccination rates in rural areas, and specifically also how we can address vaccine hesitancy? And maybe even really talk through like these celebrities, because maybe that would be a way to have this work, and wondering if we could get some folks in my neck of the woods to help out.
Thank you for that question and for highlighting data that we've discussed about these discrepancies in vaccine rates really through the end of April. Another piece you didn't actually raise is the discrepancies in telehealth, right? Rural counties would be so helpful to have telehealth in, and yet we saw in a previous MMWR that telehealth wasn't reaching for exactly the comments you said: broadband, telephone, decreased access. I think it speaks to the fact that we don't have community workers in these communities that have had a long-term public health infrastructure in these communities to do the work of public health. We don't have a public health department that is sustained, that's been viable, that's been well tended to, that has competitive salaries, respected positions, and community workers in those communities to do the work that you're talking about. And that is exactly what we've had resources that have gone out that are specifically line itemed for rural areas, because we've recognized that deficit through the context of COVID. We've had community-based organizations specifically outlined for rural areas through the context of COVID. And what we're asking for, not just to have it for the context of COVID, but now you're going to find them. You're going to find these people who are devoted to this community work. We need to make sure that they're trained. We need to skill them up. They need to be able to interact with the data systems. You don't have data systems there for people. You're doing it by hand, by paper and pencil. That is not a way to do public health in this country in 2021, never mind for what we need to reach for in 2030. In terms of what we're doing now, you and I discussed, I was in rural Georgia, and it was really incredible to talk to the people who are doing this work, who are going door to door, the elderly people, as you note, and who are hearing the National Guard didn't work. What did we need to do? We needed to be at the at the change of shift at 4 a.m. and have people trip over us and say, can you get your vaccine now? That's the kind of grassroots efforts that we're moving forward with now. That we have these confidence consults that people can call the community core. I'm a Patriots fan, I'm sorry to say, but but I bet the Bears might 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 do something to facilitate. I do think when you call these we can do this.gov, you'll get a wealth of resources. These people want to help.
Good to know. Dr. Walensky, again, thank you to you and your team for all you're doing to help our country get past this pandemic. Grateful to you. With that, Madam Chair, I yield back.